page 2 still, keep your money or stick to CBA offer, doctors tell Uhuru. So earlier this week we thought, maybe we're heading to an end of this doctors' crisis. But, you know, President Uhuru Kenyatta did offer them a 40% pay increase at State House in Mombasa. But doctors say it's not enough. And of course, their CBA is not just about a salary increment. It's about facilities. It's about better and more personnel, of course. And so they say they will not take this offer just yet. It's been 34 days since the doctors went on strike. And, you know, when the president had a meeting with them at State House, many commended him for taking it upon himself to engage in those talks, but they're now not paying off. What's next with the government?
Several things come to mind, actually 3. Number 1, the presidency or State House is an office of honor, it's an office of respected, that whatever comes from State House is supposed to be law. It's very shocking that, in fact, the president can meet with the medical doctors or their leadership for them to go through a brainstorming session. I would have expected the president would only meet the union leadership when they've got a deal. And they were going to do a media conference at State House Mombasa to announce a deal and give a way forward. But for them to go and meet with the president, and all we are told is that the president presented an offer and the offer has been rejected, it erodes the institution of the presidency. It actually dilutes it. So people now say, you can go and have a conversation with the president, but you don't have to be in agreement. Right. And I think on this one, the presidents have failed, or his handlers or advisors. The only time you get the president coming into a conversation is when you have a deal, and the president is announcing the deal, and obviously he takes credit for it. Because as we sit right now, PS Dr. Mailu has done a very shoddy job. But now going to the core of the matter, I think both parties are taking Kenyans for granted. That's the employer as well as the medical doctors. Now, when you look at the medical doctors, it's very rational of them to expect that an intern doctor can actually be paid 300,000. If for some reason the government is very irrational and offers to pay them at 300,000, every other public servant within that category is going to demand at 300,000. So it means that on average, if you work for about 7 years in the public sector as a medical doctor, you'll be going home with $1 million shillings. There's nothing bad in you being paid $1 million shillings. But the only problem is, how many doctors actually work for the public sector full-time? If you do basic statistics, it's only the interns and the medical officers who actually would work for 5 days in a week. Most of the time, these doctors who are paid by Wanjiku a lot of money, these doctors who want to be paid $1 million shillings per week, on average, they only work for 5 days in a month. That's the only time they go to the public facilities. If you want to attend a specialized clinic, you'll be told the doctor comes on Thursdays. Yet, is a full-time employee of the Kenyan government. So this time they're running their private practices. So these doctors, in my view, are giving Kenyans a raw deal. And maybe we need to have a legislation which is very clear that if you are going to work for the Kenyan government as a medical doctor, then you must work full-time for the public sector. If you don't think that it makes sense for you to work full-time, then go to the private sector. Because these guys are really, what they're doing is they're giving Kenyans a raw deal. You want to be paid a lot of money. Even what they've been offered, about 200,000 for an entry-level position, that's still a lot of money. Given that most and it's unlikely they'll spend more than 3 days in the public sector. But again, when you look at our healthcare system, we've placed a premium on curative medicine. That we wait for Kenyans to become sick, then we go treat them. One would expect that our medical doctors and the healthcare leadership, again, it's erroneous to have somebody like Dr. Mailu running the Ministry of Health. Simply because he's a medical doctor, we assume that he knows how to run this thing. We need people who've been trained in administration and management to run this. But again, we need to borrow the Cuban healthcare system. That the medical doctors in Cuba have been trained, number one, to be loyal to their patients. That if you've been posted as a medical doctor to go and work in Kibera, you actually go live in Kibera. You live and work in Kibera. You do not go live in Karen and you're working in Kibera, that you don't even understand the environment. You're supposed to know your patients almost on a first-name basis. And then you place a premium on preventative health care. Ensure that your patients do not become sick. But in Kenya, what we do is wait for our patients to become sick, and then we charge a fortune. I mean, how can it happen that a basic cesarean operation in Kenya can cost as much as 500,000. While in Cuba, it's being done for free. And it's the same medical doctors. So I think really one of the biggest challenges in Kenya is that healthcare has been commercialized. The medical doctors in Kenya do not look at their profession as a call or a duty to serve. For them, they're looking at it as a factor of production. And the last couple of days, so many pregnant mothers have died. Like last night, I saw a clip of a lady by the name Linet Ondieki, who went to Pumani Medical Maternity Hospital. The doctors were not there. There was nobody. People were yawning. Yeah, then she went to another hospital. And in the process, she loses her kid. How do you start explaining? And that lady on the face of it looked like somebody who pays her duties, her taxes, you know, faithfully. And now she's lost her kid. What is she supposed to think of Mr. Kenyatta and the Council of Governors? And more important, these medical doctors. Is there not a way that we can solve our issues while the healthcare workers are working? And maybe we need, again, to pass a piece of legislation that if you're a public officer, like Dr. Mailu, or Mr. Kenyatta, or Mr. Ruto, when you fall sick, you must go to public facilities. Right. That's the only way we'll be sure that these guys pay attention. I think
it's the same thing Magufuli has done in Tanzania now. Yeah. You know, his cabinet and what must go to public health facilities. But what's your take on the fact that, like you mentioned, should doctors ask for 300,000 entry level, then other civil servants will also follow suit and ask for that increase? And so for that reason, I understand that doctors now wanted to have their own commission, the way the Teachers Service Commission, the Judicial Service Commission. So they want a Doctors Service Commission that will cater only for their needs, because they say they're not on the same caliber as other civil servants. What are your thoughts on that?
When we're reviewing our constitution, all these union leaderships were around. And there was a conversation to take the teachers so that they are under the county government. But the leadership said no. They negotiated the other way. They said, we need to have our independent Teacher Service Commission at the national level. What was the leadership of the healthcare unions doing? They were fast asleep. So at that stage, they should have negotiated to have their own, some sort of their healthcare service commission to take care of their interests. But they were dead asleep. And you know, it's erroneous to assume that medical doctors have got the highest IQ in society. But I think this is a strike as debunked that myth. And they have to live with what we have in the Constitution. If they want to have a Healthcare Service Commission, let them speak to a number of legislators to set up that in motion. But meanwhile, they must be reminded that asking for 300,000 entry level is ridiculous. Because the moment the government says yes, then everybody in that job group, engineers, architects, even teachers, every other professional would say, we want to be paid this amount of money. And right now we are told that our wage bill is so high and you don't even get to see any returns. So really it's unacceptable. But again, on the flip side, the medical doctors have got a very good reasoning. They say, in as much as it's about the salaries, but most of the hospitals don't have facilities to treat patients. So that's something that we need to look at carefully. But right now, as we speak, for them to demand 300,000, irrational thinking.
All right, so of course, that standoff continues, no end in sight just yet. But let's move on to page